Hello, my name is Sebastian De Leon, and this week I'll be conducting a literature review for the third week of my gross anatomy class. I will be now sharing my screen. I've prepared a PowerPoint for today. Let's go from the beginning. From the beginning. There we go. Okay, so the paper is called the Biomechanical Stability Analysis of a Standalone Cage, Static and Rotational Dynamic Plates in a Two-Level Cervical Fusion Construct. I will be covering the experimental design, goals, and potential significance of the study. I'll also be conducting an analysis of the data, conclusions, and findings. I'll be covering the strengths and weaknesses of the reported findings, as well as conducting a brief overview of the cadaver ethics of this study and comparing that to what I covered last week in cadaver ethics. So, I'm going to be covering some terms that I'm going to be using frequently in this presentation. Anterior cervical discectomy and fusion is abbreviated ACDF. Now, what this is, it's a way to alleviate pain in patients that have exhausted all countermeasures and are suffering from a intervertebral disc collapse. Now, this degeneration in the disc causes the space between the vertebrae to be shrunk, causing the nerve to be pinched. Now, this leads to the pain, and what the surgeons do is that they remove the disc, they insert a spacer, and in some cases, they increase the stability of the spacer by adding a plate with screws. Two-level cervical fusion is having to do with two dynamic segments. Two dynamic segments of the spine is what they had limited data for. So they decided to, in this paper, analyze the support that is added by plate and screws to a standalone cage for the cervical vertebrae, ACDF. Intact spine is a term that I'll be using to describe a spine that is normal and unaltered. Interbody spacers or standalone cages are used interchangeably in the study. They more or less mean the same thing, exceptions being in literature and different contexts. They restore the disc height between vertebrae. Now, there's three hypotheses that are posed in this paper. The first being ACDF using standalone interbody spacers will significantly reduce the range of motion from intact spine. The second one, the use of static or rotational dynamic plate, will significantly augment the stability of standalone interbody spacers. The third hypothesis is that the plating systems, though different, have similar beneficial effects when compared to each other. The potential significance of the study is that it can build upon the current understanding of plate constructs and how they augment the stability of two-level anterior cervical discectomy fusion cases. Adding credibility to the usage of mechanically different plate constructs is another benefit that could come out of this study. I'll be covering the cadavers briefly. There were 11 cervical spine specimens for C3 through C7 of the cervical vertebrae. 48 and a half plus or minus 5.5 years was the average age of the specimens, with five being male and six being female. They were screened for conditions that could alter the biomechanics of the cervical vertebrae, such as metastatic disease, fractures, or bone spurs. The researchers chose the specimens that excluded these cases or conditions. I'll be covering the plating treatments with figure one. I took this figure straight out of the paper to show the mechanics of the plates in question. The first one is a static locking plate, abbreviated SLP throughout this paper. They more or less are your basic screw and plate design. There's not much motion going on between the screw and the plate itself. It's very rigid. And five of the 11 treatments were assigned this treatment. The second treatment is the Dupuy-Synthes Vectra Variable Angle Plating System. Now, this is a rotational and dynamic option. We have a static and a rotational variety. As you can see here, there's a ball and socket relationship between this screw and its corresponding plate that allows for a little bit more flexibility. The benefit of this in the context of the of clinical, from a clinical perspective, is that it allows the patient to assume their anatomical position without healing in some odd manner. Now, both of the fixations were unicortical, meaning they went through one layer of the cortical bone in the vertebrae, and they were also self-drilling. The spacers or cages are shown here as well with the pink arrows. The experimental protocol looked at the range of motion in three different parameters. The first being flexion and extension, lateral bending, and axial rotation. They were tested sequentially for the intact spine C3 through C7 and the anterior cervical discectomy with the standalone cage insertion at C4 to C5 and C5 through C6. Those were our two dynamic segments. Plates and screws were then inserted to all the groups, and they were either the static locking plates or the Dupuy-Synthes vector variable angle plating system that I covered earlier. So all treatments were given the spacers, and then they were either given the SLP or the vector plating system. I also took this from the paper. This is figure 3. So for our data analysis, statistical tests that the researchers used was ANOVA with Bonferroni correction for 5 comparisons, the 5 comparisons being here. They stacked the SLP up against the Vectra system to see if there was some sort of a difference, significant difference in the change in the range of motion. My apologies. So I'm going to be covering the abridged results. The SAC insertion drastically reduced the range of motion from the intact spine at the two insertions. This was expected by the hypothesis. This is seen and evidenced by figures 4 and 5 in the results section. Plating further decreased the range of motion from the SAC. This is another thing that we expected to see from one of the hypotheses, as evidenced by figures 6, 7, and 8. There was no significant difference between the performance of the SLP and the vector plates. This was interesting to me. Intuitively, you would have thought that the vector plates would have given more motion, but they actually provided an insignificant amount of additional support to the SLP, which was interesting. I'll be covering some strengths and weaknesses of the paper. Strengths are cadaveric testing gives useful biomechanical data that can be used without clinical convolutions. However, it can't be applied in a clinical setting. Some of the critiques that I had with the paper are the small things, but there's an inaccurate figure reference in the experimental protocol section. They were alluding to figure 2C, but figure 2 only had parts A and B. So a non-existent figure was referenced. There's also a miscoloration in the graph legend in figure 5. Some weaknesses I can see here are the post-operative tissue changes are not accounted for in this experiment. It'll require clinical testing in order to have applications for a clinical context. You're unable to replicate physiological loads generally in these types of studies, and the the device that they used to simulate these motions had its limitations. It wasn't able to replicate the physiological load of the head and neck. The normal load was not simulated, unfortunately, by their the technique that they used. So, are the conclusions supported by the methodology of the study and the data produced? I would say yes. The hypotheses were reasonable statements that were easily addressed by the results, and they fit within the bandwidth of the study's assumptions. Discrepancies were accounted for in the discussion section. That's something that I really like to see in papers. As for cadaver use, now, most journals require authors to disclose how cadavers are sourced, but this is left to the local and regional regulations discretion. Institutions can also apply their own regulations atop the local and regional regulations, but they're not required to. I learned this from the AAA, the American Association for Anatomists. Ethical transparency and integrity is important in cases using something as sensitive and personal as a cadaver. So knowing where those come from, at least in one sentence, would be very useful for the purposes of ethics. Do you find the use of cadaver resources in the study ethical, moral, and wise? I would say no, because there was just no information referring to how the cadavers were sourced. There was no mention at all of the consent or ethics in the specimen selection. They had a whole section dedicated to this, but they didn't mention how they got them, where they got them, or any of that, which is important. So I need to include a rationale to support my conclusions. Now, describing how cadavers were obtained ensures it is done legally and ethically. Like I said, the AAA requires institutions to document cadaver donations, but this is left to the corresponding institutions' internal review boards to set these regulations. Do I find the use of cadaver resources in the study ethical, moral, and wise? Like I said, no, there were no laws broken, but I can see it as a careless mistake to omit such information just with my own ethical framework. These are the citations. I hope I covered everything and enjoy the rest of your week. Thank you for watching.